the first trip that you were on was in 2013,
Yeah.
and that was we had a grant from Department of Veterans Affairs. And after the trip, really, you told me that not only were you pain free the week you were on the trip, but it was 2 weeks after the trip that you just started feeling some of that chronic pain, right?
Yeah.
How to explain that?
Yeah, so the difficult thing for me was coming out of surgery. I had a whole bunch of surgical adhesions and scar tissue. They cut from almost my entire torso, but essentially everywhere you have ribs from the second thoracic all the way down to the 12th. Ripped my skin open, put in a whole bunch of metal rods, titanium all throughout the back, screwed it in at every single level. And then same thing, they cut in through the front, put in a rod from T4 to 7 to bridge the gaps, crushed up all the bones from T5 and 6, put them in a new little carbon fiber cage, and stitched me back up. Secondary to that, I had all this lack of mobility. They cut through all the muscles in the left side of the latissimus dorsi, and essentially, after rehabilitation, sent me on my way. So here I am pushing a wheelchair with all this new hardware in me, and constantly using this inverted motion where I'm internally rotating all the time. And all of this causes just tons of pain and spasticity right behind the shoulder blade on the right side. The nerves they cut at the time had recovered in a way that they're constantly firing signal so that the muscle in the right rhomboid is just constantly in spasm 100% of the time. And I had, options of going on muscle relaxants, which are going to leave me sleepy, dazed, confused, and sluggish all day long. Pain medications, which have a well-documented history of complications there. So I didn't like either of these two options. So I just decided to bite down on the mouth guard and kind of try to live with it. And pain just became part of my life. It was just as the same as breathing air and drinking water to me. It was just part of my every single day. And for a long time, it was just the only friend that I had 24/7. When I sleep, when I wake up, it's just always there. So having the experience to go diving for the first time taught me a lot about myself, pushed my limits, and helped me discover new modalities that I could use moving forward. After my very first dive, I woke up kind of, or surface rather, feeling that something was off, like I was in another world almost. I felt that there was this difference. Part of my life had changed. And it took me a while to even figure out that I was living pain-free for the first time. This pain that was perpetual sense that I have every moment of every day was absent. And it gave me like a euphoric feeling. It was foreign to me and phenomenal. And I thought it would be a fleeting thing that, oh yeah, it's nice to finally have the muscles in my back to relax and that nerve firing that neuropathic pain that you can't even really treat with medication. It was like it was nice to have that gone for a bit, but it's going to be rough when that returns tonight when I go to sleep and go back to my normal every day. Well, that night and every night thereafter for weeks on end, I didn't have any of that. It was an enlightening experience for me. I was wishing that everybody could experience this kind of euphoria. For those of us in a wheelchair, we don't often get the option to move around, to twist. We're constantly suffering under the forces of gravity and under the posture that we're stuck in our wheelchairs in. And that triggers all kinds of pain and complications, medical complications from sitting all the time.
Mm-hmm.
For us to be able to alleviate that, even if it's for moments of a day, that's something that we'd never have the opportunity to do. And for me, having this euphoric feeling of lack and absence of pain for time on end, it was just an eye-opening experience and something I would love to have.
I thought it was interesting too that I learned from you that you said another reason you didn't take pain is because it masks other things that are going on, right?
Yeah, absolutely. If you take a symptom that is there to warn you and you remove it by putting in a medical intervention, there's a cost there. So as a young child, you realize as you go to reach for something that's hot, you feel the heat before you actually touch it and damage yourself. Well, if I know those senses, especially in somebody that's neurocompromised, where I have below the level of lesion, I don't feel pain the same. If I numb that signal even more, I could have my leg resting against the hot exhaust You know, I could have a cut across my leg, not understand what's going on, and have that sensation dulled, causing more and more damage as I'm getting more and more exposure because I've numbed the signal. If I have some kind of internal organ injury and I've got a pain medication on board, now I'm not sensing something, and an internal injury or disease could develop without my awareness because I'm constantly on medication suppressing it.
Yeah.
I don't want to numb a signal that, you know, is going to keep me from injury and further development of injury. So in my first rehabilitation center, there were 4 people in my room. In my second rehabilitation center, out of the 8 of us, only 2 of us survived. And some of them are pain medication complications. Some of them were complications in and of themselves. But anything I could do to make myself healthier and try to recover was going to be a better option than going on constant lifetime medication that's only going to suppress me, slow me down, and mask all these symptoms that might develop that I could otherwise be aware of.
You know, I love your perspective. You know about the pool we want to build, right? The
Yeah,
deep warm water
absolutely.
therapy pool for research, rehab, education, training, and stuff. It's not a swimming pool, right? It's a pool where you rest at 33 feet, 66 feet, and you use 50% O2 or you know, enriched air, or maybe you use a medication that it does this at the surface, but we don't know what it does at 33 feet on 50% O2. Now, based on what you know about the pool and stuff, how do you think that'll affect what is possible with rehab and research and everything?
I am extremely excited about the prospect of having this new pool developed because not only will this give patients like myself opportunity to experience a better life, a better quality of life, it has a capacity to accommodate so many different people. And being in a safe environment where you can train 24/7, regardless of the weather, you don't have to coordinate flights and travel and all the other complications that come with it. You can take all those variables out of the diving and give somebody a pure experience in a safe way. And then the research that we can develop from that, figure out why we're having these results, how we can better suit our patients, what we can do in the future to better train people to be in weightless environments. The knowledge and experience that's going to come both for the patient and for the practitioners and for all the people that work in the community of divers. It's just going to be a phenomenal opportunity for us to train on our own home soil in the United States in a place geographically located in the center of the country where it's got a major travel hub that everyone can get to easily without having to worry about passports and international monetary things and politics and all this stuff. We can train in our own home ground in the United States, bring world talent to us to help better learn and all grow this field for future generations to come.
Yeah, we're excited about the patented design, which took us 6 years to get 3 patents, and how you have a 10-foot ledge at every atmosphere, and you could put teams of 4 15 feet apart. And when we did a capacity check, we realized we could put almost 300 people in this pool at one time. And it's like, you know, you're doing research at 33 feet, somebody else is doing it at 66 feet, and because it terraces up, people can ascend to the surface without interfering with anybody else. So,
Yeah, it's an elegant design in that you have platforms and you almost graduate in difficulty as you go down.
yeah.
And then anybody that's down and on their way back up, you've got multiple levels of safety as you come back up. Because if you are having some kind of a problem, you have people above you all along the way that can help troubleshoot as they're coming back up. So a rapid ascent from the middle of the ocean is difficult, but when you've got levels of instructors above you at every step to catch you and sort you out, it just added levels of factor of safety in there for the patients as
Yeah,
well.
we're excited about it. Ian, I want to thank you and our viewers because they're going to be learning so much from your experience, and your case study today to the doctors at Mayo was phenomenal. So thank you for doing that and being
Oh,
part of it.
absolutely.
Together, we can do great things.